Well, welcome everybody to our second to last listening learning session. My name is Alicia Azurin, and I just would like to send everybody a friendly reminder. Please, as we've mentioned in every single one of these, please make sure that your name is legible. So either by going to the three ellipses up in the top right corner of your picture, you can click on that and it'll say to rename. You can change your name in your actual picture, or if you prefer, you're more than welcome to put your full name in the chat and we will document it that way. Again, this is for being able to log attendance and make sure that you guys get credit. Also for all of our CPA partners, if you will please, in the chat or again in your name, make sure that your full name and the CPA you work for is listed. We would greatly appreciate that. And as you all know, these sessions are being recorded so that we can upload them for our staff and CPA partners that are not able to make it to today's session. So without further ado, I am going to pass it along to Shannon.
Hi, welcome. My name is Shannon Ammons. I'm the Kinship Licensing Standards Program Manager. And our topic today is impacts on staff in WCAP, demo and form changes. So the Kinship Licensing Standards Project has been very excited to offer these monthly listening and learning sessions that have been about an hour to an hour and a half long on the last Tuesday of each month, which started in January. And sessions featured different topics related to the project. And we had guest speakers. While the Kinship Licensing Project is hosting these listening and learning sessions, the information isn't just Kinship specific. We designed these sessions to accommodate both Kinship and foster care staff because the themes can be applied to any applicant or caregiver. And so next month will be our last listening and learning session, which is not required for our foster care staff, but our Kinship staff can come and hear what we have to say for the last listening and learning session. Okay. So to kind of ground us today in this space, we have a brief video to share about change. This clip is from Sarah McMullen. She's safety and monitoring licensor who has been involved throughout the development of the new Kinship Standards Project and supporting materials. Let's go ahead and listen to her.
Change is also part of our agency, and I think just doing your best to work within and adapt to the system that we have, because it's inevitable that change will continue to happen, and find the way that works for you.
Perfect. I'm actually going to pass this on to Dion.
Hi, everyone. My name is Dion Johnson, and I'm the Foster Care Program Manager with Licensing Division. So glad that all of you were able to join us today. And so you have likely already seen these important dates, but we want to make sure that you know and that you have them in your heart. Okay, so we are going to repeat these dates. Since many of our forms are being updated or replaced on the Kinship track, if you know you won't approve a Kinship license by June 27th, don't draft any supervision plans, administrative approvals, waivers, or license letters until July 1st. If you are working on a Kinship home study or Kinship renewal, it must be completed and reviewed by the end of the business day on June 2nd for our CPA partners so that you can submit it for review. And then it needs to be signed. So everyone's needs to be completed, reviewed, and signed by June 27th. For foster care, Kinship care, and regional licensing. Any Kinship home studies or renewals pending after those dates will be moved to the new or updated forms on June 30th. And I will pass it along.
Hey, thank you. So we wanted to talk a little bit briefly about certified respite. It's a small percentage of the work that we do, and we have clear guidance for you about what's required for each type of certified respite. We are creating a new type of kinship certified respite where you can provide certified respite in their home without being licensed. And so the certified respite track will be used for three purposes. It's going to be used for certified respite in a foster home, certified respite in a licensed kinship home, and certified respite in a kinship certified respite home. That was a lot to say. So when you get your first certified respite assignment, we encourage you to kind of look at the procedures, work closely with your regional licensor, your supervisor, to ensure that you are completing this correctly. So you can also reach out to the WACAP portal inbox for questions. These applications are really few and far between, which is why we wanted to kind of keep it on the same track. It didn't make sense to have like 3 different tracks. So technically you could do all 3 kinds of certified respite, though we anticipate that to be kind of rare. So when you have this come up, please reach out to those people I mentioned earlier to get further guidance. I am actually going to turn this over, I think, to Sean. So Sean, I'll let you introduce yourself and go through your slides.
Yeah, so I'm Sean Van Harmel and I'm with the WACAP team. So I'm one of those folks responding to some of those emails y'all are sending to the inbox. So I just wanted to give a quick update because changes are happening with regard to the procedures and what we would call WACAP guides or process guides, process maps. They have a bunch of different names. So we're trying to clean all that up for you all. I know I hear applause. And so some of the procedures are being rewritten, and essentially what they're going to do is refer to a WACAP user manual. In those WACAP user manual, it's going to have just specific steps to complete in WACAP. So we're going to have those separated out because currently you've got essentially procedure and WACAP steps together in one guide, and we're trying to separate that to keep it cleaner and easier to understand and utilize and to update in the future. So what you're looking at right now on the screen, you've got the procedure on the left for what we call the family tags. So that's kind of what it looks like on the left in the procedure, and it's going to say essentially refer to the WACAP user manual to how to complete that in WACAP, and the user manual is referenced there on the right. So it's just the basics. Click here, do this, and done. So that is pretty much it for that slide. And the next one, we wanted to encourage you all to make sure that you update your notifications or make sure you check them. The setting that you have currently, just go to the top right corner in WACAP, your initials in that circle there, click on my account and just check and make sure your notifications are the way you want them to be. It's again, any status change notifications, renewal notifications, form completion, those types of things. You can get email notices on those. So make sure you have those all the way you'd like them to be.
Okay, so now we are going to do something a little bit different than we've done in the past meetings. We are going to actually at this time ask for those of you who are interested and wanting to know what the foster care side of this will look like. We are going to drop a separate Zoom link into the chat. And what we would like you to do is to please copy that and then close out of this meeting. And Amy and several others of our wonderful kinship licensing standards team will meet you over there to go over all things foster care. For those of you who are going to be doing and working with our kinship families, or if you are not a DCYF employee and want to know and learn about the new forms that are going to be coming up, please stay in this meeting and we'll go over all of that together. So we'll be separating, and for those individuals that are moving over to the foster care meeting, we will talk to you at a later time. I think that is everything. Is the meeting link in the chat? Okay, so yeah, at this time, if foster care is where you want to be, please go ahead and copy the link and go into the new meeting space.
Okay, I see the numbers are staying the same. So I think we could go ahead, we can go ahead and start to go through the slides for the kinship stuff. So again, this is the kinship kind of area that we're going to be talking about form changes and doing a demo in WCAP. So we can go to the next slide. We're going to talk about kinship form changes. We're going to talk about the kinship license move assessment. We're going to talk about the kinship license renewal assessment, the kinship license monitoring visits, and licensing support agreement. And then we're going to talk about a new thing in WCAP, which is only going to be specific to kinship, and that's add additional requirements. Okay. What I think what's really good to know is that the KLS project had several work groups that looked at the forms, and the people that were in those work groups were actual people that do the forms themselves. It was from people from home study specialists. We had SAM workers. We had child welfare in these meetings. We had OTR in there, CPAs. We had a very collaborative bunch of people that we had looking at these forms and creating these forms. So many of you already got a list of like the forms that were updated and created. If you haven't, hopefully you will be getting that soon. Let us know and we will get that to you as well. So many of the forms were shared for foster care and kinship. And when we looked at these forms and we decided that they needed to be like updated, we just created kinship versions. So you're still going to see like kinship kind of options within the foster care forms, but you will be only using the kinship forms. And so after the work group kind of did these form stuff, we gave these forms to WCAP. And WCAP, before they did their reviews, their role was really to make sure these forms work in WCAP, that it was plain language, that the Department of Justice and Americans with Disability Act rule was in place. They facilitated forms review groups, and they coordinated with our DCYF forms manager and Binti to get these forms completed. We can move on to the next one. So when we talk about how we needed to do compliance for ADA, that means the output report is going to look different. And this is kind of a screenshot. We'll be hopefully able to show you later on exactly how it's going to look. But on the left-hand side is the way the form looks now. And on the right-hand side will be how it looks for output only moving forward. We can go to the next slide. Okay, so what we wanted to kind of let you know that there are forms that will no longer be on the kinship track. So the personal information, reference questionnaire, the home study, the 10-043, the applicant medical report, self-report will no longer be on the kinship track. Those will still be on the foster track, but they will not be on the kinship track. The financial worksheet is no longer going to be on the kinship track. And if you use that as a tool, when you're doing an adoption, you can certainly fill it out and upload it, but it will not be on the track and you will not be waiving it. And we will no longer have the relative non-safety exemption, the 15411G. So, the other thing to this is that, I don't know if some of you, well, those of you who were doing unlicensed kinship home studies and licensed kinship home studies, you would have saw that there were two different versions of like the home inspection or the file checklist. Well, now we have kind of streamlined it. And so the home inspection checklist will live on all kinship tracks. The file checklist will live on all kinship tracks as well. And then for our CPA partners, you will have a kinship version of the file checklist and certification for license of kinship homes, the 10-016, and it will be A now for kinship. Okay. So now we kind of what we wanted to do is show you the fun part. What is this? What are these forms going to look like in WCAP? So Emily, do you want to introduce yourself first?
Sure. I'm Emily Stentz. I'm one of the other members of the WCAP team. So again, probably someone you have emailed in the inbox. Yeah.
Okay. So what Emily has just sharing with us is what the new kinship license move assessment, the 10-405B, will look like. So this is something new for our state workers, but our CPA partners, they've been doing this before, but this will be the new version of that form. So the move assessment, it's shorter and it focuses on information needed to license the new home environment. So if you go through, it's going to ask you for applicant A and applicant B information. You're going to fill it out just like you normally would. It's going to have radio buttons, and then it's going to have questions that are required. You'll see the asterisk mark, and then you'll have narratives that you will need to put in. So, and I don't know why I'm like, your screen looks so small to me. So let me see if I can, oh, now never mind. I made it bigger. Okay. So then you are going to ask these questions where it's, can you go back up to general, please? Yep, so you'll fill out this information, and then the next part will be the assessment part, where it says, thank you, that's what I was looking for. Have there been any changes to the following since the most recent home study or reassessment? And we're going to be asking about household members. And again, remember at the top of this is the guide is going to be linked and it will provide you with guidance. But when we're asking about this, we want to know, is there new people in the home, new people on the property that have unsupervised access to children, or people who have moved out of the home or on the property? Those are some of the questions you're going to be kind of asking when you say yes or no to this one. And then we're asking about health and well-being of applicants. And we want to know, this is referring to like their health, counseling, therapy, alcohol or drug use, people that they rely on for support, relationships, conflict or violence, or domestic violence. This is a big section that's in the kinship home study. And when we're asking you this question in the move assessment, we're hoping that you're looking at your kinship home study that was done last. You're looking at the guide and you're asking them if any of this stuff has changed. And again, if it hasn't, you just say no. If it has, you're going to say yes, and you're going to say what has changed. Okay. Thanks, and then the other one is like, do the applicants need additional support to meet the needs of the family or the children? We're going to assess this every time that we're talking to them. And even if you say yes on this one, we still want you to just, or actually, is this wrong, Em? Is that required? Oh, yes,
It's required, but
it's required. We will want you to tell us what services and supports they have. And these are also forms and demos, so some of these things might need to change as well, just as we're still testing these. And then we're going to ask you to describe the sleeping arrangements. We want to know where everybody is sleeping. And then we also want to ask about the permanent plan. Is there a home study update that's going to be needed? And then you're going to talk about the licensor evaluation, which is really similar to the evaluation that you are kind of going to be doing when you're talking about the home study. So you're going to talk about the strengths, the limitations, the outcomes, the recommendation, any concerns that should be addressed with solutions, showing that the applicants can meet the needs of the children or youth. The approval of the assessment should be clearly documented here. So that's the MOVE assessment, which is, again, a shorter piece. And this is what the output report looks like. And again, this is the way it looks different because of the ADA compliances. You're going to notice that we're not going to have a lot of tables in our forms anymore. But this is what the output report will look like. Does anybody have any questions about the MOVE before we move on to the next form? Okay, so the kinship, this will be the kinship license renewal assessment 10-405D. And this is going to be a much more thorough assessment than the MOVE, obviously, because this is when you're renewing for another 3 years. So again, you're going to put the applicant's name, applicant A, applicant B, and then you're going to move through to the assessment part, which again, is in the guide. It is linked to, if you're like, what do I really need to ask? Like, the guide will help you ask these questions. Thanks, so you're going to do that, and it's going to, again, it will look like you did with the, MOVE. Household members or individuals on the property, like, have there been any changes? Yes or no, right? And then we're going to ask about the health and well-being of the applicants and see if there's been any changes to that. And then are there concerns regarding domestic violence, maternal or partner status? Did that change? And then the physical structure of the home. We're going to ask if any of that changed. And this is just a brief review because you guys are going to get an additional training on this. Then we're asking you, we want to know how the applicants can help the children or youth stay connected to their cultural background. Again, this is this question is very similar to what's in the kinship home study and in the update. So we really try to make questions very across the board so that there's no confusion on what we're asking. And then we're asking about any changes about the child or youth's behavior, their physical, mental health. We want to know any of that. And we also made this one, describe any parenting challenges the applicants have experienced and how they have addressed them. And we all know that, as there's always going to be parenting challenges. And so we want that to be assessed and talked about. We're going to ask them if there are any trainings that they need that are specific to the child or youth that they are caring for. Remember, training in general is not required with the kinship licensing standard, but it is if it's for safety and need of the child. Like if a child is on, has a medical condition, we're going to want them to have training on that.
Keep on running through.
Yeah, you can keep going through. Yep, we're gonna talk about discipline. We're gonna make sure that they will follow the discipline WAC that we have. We're also gonna be talking about their strengths, limitations, and this is actually, we're asking the applicant to describe their own strengths, limitations, and additions, which I think is a little bit different from what some people have maybe you haven't done this if you haven't done a reassessment. So we're asking them to tell us. And then we are, assessing if they need additional support to meet the family or the child and youth.
Shannon,
Yeah.
are you able to see the chat? There's a question that came in. Do you want me to read it to you, or you got it?
Yeah, if you could read it, that would be great. I haven't.
It says, when a family needs an update but is also up for renewal, are we doing both forms?
Is Deanna on here? Do you want to take that, Deanna?
Sure.
I think I know it, but I don't want to.
So we would first consider, does the update result in a new license? Because if it does, then you would do the update in place of the renewal. We wouldn't want to do two processes at the same time. And there might be a reason that these two processes do need to stand alone. So first you would look at, do we need a new license or not? And then you would work with your supervisor and consult with the family on what the best course of action for that specific situation would be.
Thanks, Deanna. This is, and Emily, you can just start clicking through slowly so people can see, but we're asking about sleeping arrangements. And this is, we're asking, have there been any LD CPS intakes in the last, licensing? And then you would be filling out that. And then you're summarizing the information and the outcomes and any support or services that were, I think, offered. Thanks, okay. And then that's,
Same thing for.
yeah, what's that? Yeah, assessment part 7. And then we will be asking applicants if they have any suggestions on how we can improve. We'll be asking if there's any admin approval or waivers. And then we will be talking to the caseworker about the permanent plan and if an update is needed. And then did you reach out to any caseworkers? And filling out that information and what the caseworkers have said. Is the renewal done in person or via phone? Deanna, you want to take that one too?
Yep. The interview for renewal as well as an inspection are done in person.
Thank you. And then the recommendation part.
Do it like how has people died?
And then the recommendation is you will be filling out like the number of children, the age to the highest, the starting date, and that is the renewal assessment. Again, you'll have the kinship home study and reassessment practice guide that will be available to you that will kind of help you a little bit, and you'll also be getting additional training. Do you want to show what the output report looks like? So this will be the output report, very similar to the MOVE, but it will just be less. or the move will be less than the renewal. Sorry, I said that backwards.
Shannon, there's another question in the chat.
So with these updates, will this make the kinship home study process move a little faster?
So I think our goal of the kinship licensing process in general is to streamline it, remove barriers and simplify it a little bit more. The forms that we've been covering, these ones are specific to renewal and reassessment. And so for those of you who are familiar to doing moves or renewals for foster care, I think they'll look fairly similar. We did try to align some of the questions so that it tracks better between what we're asking in the home study, what we're asking in the reassessment. So hopefully that will make it a little bit easier and faster since it's in alignment. I hope that answers your question.
Yeah, I'm new to all of this, so just making sure, because I only do kinship. And so just making sure that when we're going in, because I have quite a few up right now that I've paused because of all the new things that are rolling out, hopefully that it'll make the process a little easier and faster for the families, because it just felt, like there was a lot going on. So just wanted to make sure I'm asking all the right questions with all of the new forms and things you guys are getting rid of, as well as for renewals. So that was all.
Great. So that's what the move and the reassessment are going to look like in WCAP. And then, if anybody else doesn't have any questions, I'm going to pass it on to Anna to go over the next two forms. Do any of these forms pull from any of the applicant forms or home study? You want to answer that? Does anything auto-populate?
I think so. Kind of a way to hold this section steady while this section over here scrolls, so you always have access to this side navigation, I think is what the question is.
I'll take this. So,
Yeah.
So I think that the applicants' names and their like address, the stuff that's on the
Model.
Will populate, but no, this is a new assessment. When a person is moving or it's been 3 years and you're really doing a reassessment of the family. So many things can change in a 3-year period or after a move. And so you would be actually doing the assessment over again, which is something that folks who have been doing renewals and moves are used to as well. It's a new assessment at that time.
All right.
Is that first question? And I think Emily was answering the second question.
Yeah, I do think that the applicant names will populate into the new forms, but other than that, yeah, I think we have that. And then as for how this stuff works in WCAP, that's I'll check in with Binti on that, but that's not something that I've heard of. I don't believe it's on their radar, but we can certainly ask them about that. Yeah, there is, if you want some cheats, there are some things I think you can do of like using the home and the end button. The end button brings you to the bottom of the page, and the home button will shoot you up to the top as quick shortcuts if you don't want to scroll up to get to the next page. But you probably want to hit the save button before you go on to the next page.
Okay, I'm going to pass it to Anna.
You guys, there's one other, no, did Lisa's question get answered? Is the renewal assessment the same one?
Not yet.
Okay.
And it is not the same as a home study update, although I think it looks very similar because we are reassessing. Although the home study update typically has a lot more child-specific information because we're typically doing that because we're adding a child to the home. And the reassessment is a little less specific to, redigging into that information about the children and is more general about how things are going in the home.
That it for questions before I jump in? All right, everyone. My name's Anna Enriquez. I am a workforce development and training specialist with the workforce development team. I'm going to walk us through a little bit of a demo here with Emily on the kinship license monitoring visit form. So as we move ahead with work come July and just our role changing. So kinship care licensors are going to be completing health and safety monitoring visits. And so that's one of our ways that we will be able to continue our work with kinship and offering service and support. We will be checking in with them. We will be offering and building rapport with our caregivers. And then the purpose of the monitoring visit is for that, but also to make sure that we are offering support along the way. So Emily, we have some kind of like it was asked here earlier with what information is populated into this form. You can see names are. Some of that basic information is going to be going into these forms. And then we will have to fill some of it out also. So the health and safety is going to be required on 10% of your caseload annually by June 30th of each year. And we will need to be doing these in person with at least one caregiver. Let's see. So let's see. Emily, some of this information, is this, because again, we're working in demo. I just want to make sure some of this information, what is pre-populated and what's not. So some of this we will have to just enter manually based on the information that we know for the home. Let's get a visit date in there. So license capacity, number of current placements. We enter names of the kiddos that are placed in the home. One thing that we'll do too when we're doing our health and safety is when we get to scheduling, we will want to try to schedule for a time when the kiddos are going to be home. And you will see in the specific form, I love the names, Emily. So we will see in the form as you kind of walk through it, it's the perfect guide for how we do these and just the kind of questions that you're going to want to be asking as you're doing these health and safeties. Okay, so looking here at the WACs, so it's asking about conditions of the home and whether those are met. So we can do yes, we can do no, NA if something doesn't apply. Same thing with sleeping spaces, all sleeping areas, yes, no, or not applicable. Storage of medication or substances, everything that just kind of goes along with that WAC for 110, 149, 0190. And then emergency preparedness. So like I said, the main thing and the really cool thing is that we've got the form so that as you're out there with the caregiver, you really have this guide of what kinds of questions we want to focus on. Also remembering though that because these are child specific and age matters, right? Because it's who the child is that's in the home. We want to make sure that it's specific to them. So if they have an infant, we're looking at specifics for infant, safe sleep, and safe sleeping environment. So that kind of stuff. And then we're looking at any mitigation for any hazards or risk that we see. and then we would also want to follow up with the safety or the supervision plan for site-specific conditions if one is needed. So that may be a yes, it may be a no. And we know that from our work in how those work.
Anna, you have
Yeah.
a hand up.
Okay, I thought I heard something and then I looked in chat and I was like, oh, I think it's just Renata following
Yeah,
up on
it is.
something.
It is just me. I just wanted to call out to make sure that everybody on chat saw that this form is for state workers. Child placing agencies have a requirement, a different requirement based on their contract on health and safety visits and follow their own procedures about health and safety visits regarding, in alignment with the contract. So bear with us while we pop through this new work for our state licensors, and we appreciate your patience.
Thank you, Renata. I was going to mention that and I forgot, so I'm glad you remembered. So for our staff, we do have this form. And let's look at the household stuff. So it's got that prompt of who's in the home. And then that will obviously, if we've got new people in the home, then we know we would need to do, additional background checks. So this is guiding us through that whole piece of our work. And as you're going through these different questions, based on what people are answering, this is that perfect opportunity for us to look at what it is that the family needs. Are they going to need any kind of training based on the information you're finding, based on interviews with the caregiver, based on interviews with any kids that you're meeting with? We also have a spot for any nonverbal kiddos. And I know I'm jumping ahead, but we do have this section for them also to be looking at some of the areas, just looking at how they're interacting with those kiddos, all of the stuff that we typically do in our observations with any nonverbal kids. But again, just making sure that if we need potentially training, if there's something that we can offer to help out with preserving placement and just helping them along the way, that can also be concrete goods. So we know we have that ability to pay for some things to make sure that families are getting what they need. Okay. Right there. So you've got the kiddo, their age, an assigned worker. And then there's some prompting questions there that you can see in that guiding text to kind of guide your interview too with the kids on what, are they feeling safe in the home? What does discipline look like? All of that kind of stuff that you would want to know if you're meeting with kids. What are the rules around food? That kind of stuff that are, is important for us. And then any additional notes. So was there something else that they mentioned, maybe something that they would like, something that you can, refer back over to the child's worker. So all of those little things are captured on the form. All right.
And we skipped some of this.
Yeah, thank you. Because I skipped ahead. Okay, so here we're looking at the caregiver that was interviewed, and we have to be interviewing at least one caregiver, but if both are available and both, would like to participate, you can definitely interview more than one caregiver. And it's just, again, that opportunity to check in with them and see how things are going. If they also need any support, any services, do they think they need training? Is there any concrete goods we can provide? And then just finding out information about the home in general. Again, just to best see how we can support them. All right. Do we have any questions about this form? For anyone that has ever done any kind of SAM work, this will probably look familiar. We took the form and modified it for kinship specifically, but it did come from that work as well. So you may see a lot of things similar in this one. And then there is the output report and what that looks like once you've completed the health and safety form. So there it is. Does anyone have questions?
Will this be more accessible to our families?
What was that?
I'm gonna, yeah, I'm gonna hold that question until a little bit later because it's not applicable to this piece of information. There was a question about concrete goods being ordered during monitor visits. And for CPAs, that's once a year as the child ages, or is it only done at the time of the initial license? So if there is a concrete good needed to support the family and support placement and support licensure, at any time you can be working with your regional licensor to see if a concrete good request makes sense. We want to make sure that these families have what they need to support the children all year long. So please work with your regional licensor if you're seeing a need for your family to staff if that's an appropriate request. And then, yes, Ryan, this does have to be assigned. This is a signed document when you're done.
And then do supervisors have to review the form?
Deanna, do you want to talk about that?
Sure. So there is no distinct process in which the supervisor would review the content of the form. That's not part of procedure. Supervisors will be working with licensors to determine that the 10% has been met. And so that is what the supervisor would be monitoring, as well as staffing any support needs that the family might have after that visit has occurred.
And then there's also a question, Deanna, about how do we pick the 10%? And is there a process? Can we go out with the child welfare caseworker for a health and safety visit?
So the 10% can be, we'll say, randomly selected. And there is no like tickler system that says this is your family for the month or these are your list of families for the year. So it's really ideal if you're connecting with a family in the middle of their licensing process. But again, there's nothing written in stone about, that how you must do that. And yes, you can go out with a caseworker for their health and safety. I would just encourage you to be mindful of what the family might prefer. They might want everyone to come at the same time and they might not. So just being really aware of what might work for your kinship caregiver and the children in their care.
Thanks, Deanna. And just a reminder, we do have additional training that we're going to be providing here in a couple weeks, maybe 3 weeks or something like that, on all of this information. But I love the questions that are coming that are starting to get you thinking about, hey, what is this going to look like? And, how does this impact our caseload? Okay, so how does the 10% get calculated? So 10% of your caseload. If you have 40 homes, you've got 4. And then let's see. Does the 10% need to be done?
The 10% questions until, again, we're going to have training specific to this for our foster care staff, for our kinship care staff, and our CPAs are not doing this as well. So these questions we'll write down and we'll make sure that they get answered in your next training specific to health and safeties.
Yep, and I apologize. I don't know who all of our CPA staff are. So if there's questions coming up, I'm really answering specific to DCYF and how we do and how we will be doing things for our kinship care licensors specifically on the state side. Okay, provider numbers are always changing, so sometimes it will be up and sometimes down. So again, how is that 10% maybe calculated? So we might hold off then on those 10% questions for now. And then we will get more information to you at the time of training. Okay, do we have any additional questions on that before we move on to the next topic or the next form? Okay, well, let's keep going. So the next form that we wanted to take a look at here is the licensing support agreement. Has anyone heard of that yet? Let me see a hand up or emoji. Jesse says high five. Anyone? Couple. Awesome. Okay, so the licensing support agreement is similar to what we use as far as like a compliance agreement, but it's also vastly different. So what it does is it brings a family back into compliance. Whenever we have a family that has where it's been determined that a rule has not been met, we would use a licensing support agreement. However, these are very, very specific in when we use them. So with the licensing support agreement, when a rule has been determined to not be met, and if it's in response to an intake that we received, and now we have followed up on that intake and have determined that we have a valid, this is when we would do a licensing support agreement. So, Emily, let's look at what this form looks like. Yeah. Well, actually, you were fine where you were at. Okay, so we've got names there. Again, some of this information that does get pulled, and then we just start filling in the information there. So we've got provider number, we've got our address, our worker contact information, and then the information goes here. So we will be making a couple of different changes. Again, we mentioned earlier, demo's not fully caught up with the changes that we're making right now. We will not have this question on whether it's related to an intake. I just mentioned it. We would only use these in relation to an intake that we have followed up on and determined that a rule has not been met and a family needs support to get them back into compliance. So here we have a place to document what intake it's related to, right? So we get an intake number from FamLink and we're going to plug it in here. We also have a provider action number here. So it's related to a provider action that it's linked to in FamLink. One thing is for those of you that know or have gotten multiple intakes, but it's on that same issue, we can use multiple intakes in the same box, and we would just want to separate them by a comma here. The reason why we are encouraging you to do that is so that you don't have to retype the provider action number. If you see there's an add another box right there, that's not necessarily needed unless you have a provider action that is separate from all like these specific intakes, which may not be the case, at least not most of the time. But it does have that option there where you can separate them out so that they're all in separate boxes, but it's really not needed. It would just create a little bit more work for you.
And Anna, there was a question in the chat. I just want to clarify that my understanding is that child placing agencies currently use compliance agreements for foster care. And so on the kinship side, you will not use a compliance agreement. Instead, you would be using this, which is the kinship version. So yes, this is a form you will be using.
Thanks, Renata. Shane, and I see your comment too. It looks a lot like collaborative compliance for sure. Yeah. Okay, so let's keep going there. Okay, so when you're out at your home doing whatever it is, you've responded to a specific intake, you're not going to want to be filling these out there when you're with the applicant, or sorry, with the caregiver. The support and services plan is really meant to be thoughtful and more in line with after you've staffed with your supervisor. So when you're out at the caregiver's home and you are seeing any kind of issue that may be a valid, what you need to do is you need to address whatever that issue is to make sure that the environment is safe. And whatever, you're going to make recommendations there. You're going to maybe look at, if you need to order something for them, so whatever that support looks like while you're there, that's what you're going to be doing when you're there. Even if something looks like a valid, you are not going to be issuing a valid while you're out, visiting a family. You're really just focused on what is the issue at hand that whatever that intake is that you're following up on. That's what you're focused on. So you are offering support, you might be offering a service, you might be offering some sort of concrete goods while you're there, and that's okay to do. And then you're going to be going back to the office, you're going to staff whatever your recommendation is. You're going to be talking with your supervisor to determine if something is okay to leave at, hey, this is, this family needed support and services, and this is what we have in line, or in place to provide to the family to get them, on their way and to keep supporting that placement. Or you may end up with a situation where it's a little bit more serious, where they will need support, but they will need maybe something additional, and you may need to issue a valid at that point. That is once you have staffed with your supervisor and come to that conclusion that you have a valid and you do need a licensing support agreement at that point. Okay, so we look here. So we have there the WAC, the specific number that looks like it's a rule that hasn't been met. And then you're going to have a description.
Sorry, I have to interrupt really quick. There was a question about, is this form completed with intakes that are just screened in or screened out intakes as well? So clarifying that we will now, starting July 1st, we will be screening intakes in again for kinship caregivers. We won't be automatically screening them out. If it does turn out to be a screened out intake, we could get a screened out intake. We would not be completing a compliance agreement on a screened out intake. Not compliance agreement, support and service plan, for a screened out intake. So only if it screens in and it is valid that they are not meeting the WAC and need some support.
Thank you, Renata. And holy cow, we all need a little bit of grace around these terms, because just like you all, we are, trying to get, cut back on the history of what we know of these forms and the names of them, and just like the work that we're doing. So we will be making probably mistakes along the way in what we call these different forms, but it's that mindset shift, right? Getting us to a place of supporting these families and changing some of that terminology that we all know and have known for years. Okay, so where was I? What was that last question that had come in? Was there another question?
You're good. And you worry about the demo and I'll worry about
you got the chat. Okay,
Yeah.
perfect. Okay, so Emily has an example here for us. So we have a WAC. We know that's not a real WAC. It's just a sample here. So we need whatever it is that we need to keep our kids safe is what goes in this description and summary of the need. And then in the plan of support, that is what it is that we need to support this family. So DCYF, LD, whatever, we will do, XYZ. And then we will have that planned date of completion. All right. Okay, so we have that filled out, and then let's take a look at what that looks like in output. Unless I missed a step, Emily.
That's what comes next. I'm just trying to decide whether I take you through the view behind the curtain.
Yeah, for signing, right?
This is our testing track, so it's not anything like we hope anybody else has to look at.
Okay, so that's what that looks like. There it is. So it has that whack. If you can see there, it has the whack of, whatever it was that the rule that wasn't met, whatever it is that the family needs is that summary of the need, and then how we are planning to support the family, as well as that date for completion, that planned date. Okay, and then we would look at that signature stuff there.
And this is one of the ones that so for our folks who are kind of going to be new to this form, the worker signs it, and then it goes to the applicants to review and sign. And then it says supervisor, but it's the worker signing again.
Mhm.
So the worker signs it, the applicant sign that they agree to it, and then it says supervisor, but it would be the worker signing once they've received like notice that whatever has been completed, they've received whatever thing we've ordered or training or whatever the item's been complete.
There it is. And Emily, I'm guessing we will have, kind of like we did with the compliance agreement that we have currently for foster care. I'm guessing we will have a guide as well for just so, people don't have to keep track of, okay, so who signs here? Is it me? Is it since WACAP says something different on there? Okay, perfect. So that is coming.
We are moving away from guides, so we won't have guides anymore, but there will be clearly outlined procedure and WACAP user manual for state workers, and I'm not sure. There will be resources available for CPAs on some of that as well.
Awesome. Thank you.
I just have a note for our child placing agency workers that are here. You will continue to complete the child placing agency foster home licensing investigation document. And we did not update that form to reflect the kinship terminology because in it, it says, explanation include any corrective action taken or proposed compliance agreement. And we just didn't update the form. So understand that in that spot where you're including any corrective action taken or proposed compliance agreement, you would comment that you have completed this support and services plan, or the proposed supports and services plan in that place.
All right, we've got another question in chat. So does the provider action close when the date of completion has been met or when the support plan is signed?
The provider action is handled on the state side, and there will be further trainings for our state workers about how to handle these. So we're going to just save our time, and we will cover that when we do our training for the state side.
Okay, I think Renata.
Additional questions?
Oh yeah, now, if there's no more questions, then Renata, you will be up next.
Okay. So I want to tell you all about something that I am very excited about, and I hope that you're excited about it too. And for the time being, this is only on the kinship care track. Kinship license, kinship tracks, as well as in the respite template that you'll see this. It is called Add Additional Requirements. And we have been waiting for many, many years since we adopted Venti in the first place for this to be an option. So this is basically the reverse of the waive requirements. So on this track for the kinship license, there are some forms that are very rarely used, but we still want them available in WCAP. So what that's meant is for every family, we've had to waive the requirement, and it's taking lots of time. So we now have this new option to add requirements. So for some documents where we are not using them super frequently, we've made the decision to turn them into add additional requirements. And this can be used for a worker document, an applicant document, or a supporting document as well. So an upload spot. So Emily, will you click the add additional requirement box?
Yeah. I also I just wanted to pull this up. This is the applicant's view of their screen before I go. And you'll notice some of this will be changing, but you can notice that there's currently 5 buttons up here on the little pizza tracker thing. So I just wanted to point that out here because for the applicant, this is going to open up and move.
Yeah, so actually what we've done is we've gotten rid of the conditional requirements bubble entirely. And instead, if you add a requirement that a family has to sign, it will pop up a box or a bubble that says additional licensing forms or something like that. Some sort of additional bubble that will pop up. So if you click the add additional requirements, you'll see that there will be a list of requirements that should be completed. And depending on what track you're on, if you're on that first license or if you're in the renewal track, we've determined which forms would be appropriate. And so an example, none of these are accurate right now. These are just examples. I think the one that is accurate maybe is the letter of an ICPC closure letter. So you could add that letter if you are working with a ICPC family and then pick who the requirement is for. And this is a worker form only.
Yeah, it'll only give you options that make sense for our form. So
yeah, since it's a worker form only, that's the only option. When you submit it, you will see that under where the worker forms are, agency forms, you will see that it has been added and it will look like any other form. Now, if you accidentally add the requirement, you can't delete it. You have to waive it then. So don't add requirements that you don't need to, or you'll have to go through that whole waive process again. And then, but just as an idea of which forms we're talking about, this is like for an administrative approval, or a the fingerprint, you know, if they fingerprint 3 times and it won't work, and we need to do the alternate approval to fingerprinting, that way we can add it if we need it. But hopefully this will save us some time, a lot of time on our requirements, and it's a pretty I mean, it's a pretty easy, like once you see it work, you know how it works. So I don't know if there's any questions about this, or I just want to look at my notes and see if I'm forgetting anything. Yeah, I think that it's pretty self-explanatory. So you could, for example, if you're doing an adoption and they had you know, marriage certificates or divorce decrees or death certificates to upload, you could add it for them. You could pick which caregiver it's for. If it's, you know, only one of them has a prior divorce, you could just, you know, pick the single caregiver, pick one, and then it will pop up on their side for them to upload.
Yeah, so it's only going to let you add the forms where it makes sense to add them. For how things work in WCAP, if you want to upload, or if you want to add a requirement for caregivers, it's gonna add the requirement for both caregivers, because that's how WCAP works. This isn't a case of where you don't get to pick that individually, but for supporting documents, we can have supporting documents for either one or the other or both. I do think it is pretty cool because you can choose to add it for both at the same time in here, and it won't let you add it more than one time. So once you add the document or the form, you can still select it again, but it's not going to add it another time. And it doesn't clear out the version that was already added. It's probably too much in the weeds.
And I see some way cool comments, which I agree with. And yes, we're putting it into effect both on the initial application and home study page, as well as the renewal page. So you will be able to utilize it. And we are anticipating being able to do this and roll it out on the foster care side at a later time. But right now we're just using it for kinship, since that's what we're rolling out right now, as it became available. Cindy, I saw your question in the chat. If you need something that's not listed, do you contact your regional licensor? Can you clarify that question? Was it about the support agreement in particular, or about something else? Any forms on the additional list, like the add additional requirements list. We are, once we go live, all of the forms that you should need should be on there. They will either be programmed in as a regular form. Some of them we kept on that aren't applicable to everybody because they're applicable to enough people that it made sense to just keep it on the template. And then the ones that are used very rarely, we've moved to the add additional requirements one. So hopefully there shouldn't be anything that you need that isn't already built into the template, if we're designing this correctly. If you find after go live that we're missing some things, please let us know immediately so we can fix that.
Renata, I wonder if the specific question is, can CPAs use the add additional requirements function, or do they need to reach out to their regional licensor?
Oh, got it. If it is something that you need when you're working with your family, then you can utilize the add additional requirements function. I think most of the forms, maybe DCYF only forms, honestly. So you may not need to utilize those a lot, at least the worker side stuff. But if you need to add those upload spots or something for your families, then you will have that functionality.
I think the medical report is going to be an add additional requirement. So that would be something that you it would be something you would probably use a lot, Cindy. Or maybe not.
Yeah, if you're doing for adoption, we would,
Yeah.
That's a requirement for adoption. So we would
Yeah.
be adding that. Any questions on the add additional requirement functionality? I know it's a brand new exciting thing. And I think once you get to actually use it in WCAP, you'll see that it is very intuitive. So I did see that earlier on we had a question in the chat that I sort of saved until the end. So we can start revisiting some additional oh yes, are the additional requirements on the file checklist. And so they are ones that if you need them for something, they should be noted. For example, the fingerprint one is not on there because background checks have to be completed. So that's already covered. If you need to use that, one-off form or the ICPC form, that will be covered elsewhere, but you should recognize that you'll need those forms depending on what you're doing. Any other WCAP questions that we have? Okay, then there was a question early on about, will the WACs be more accessible to our families, similar to how the non-discrimination form is available in the portal? And so we will, there will be the WACs will be available online. And we are working with some folks through Bloomworks to create on our DCYF kinship page some plain talk explanations of the WAC requirements that I'm hoping that workers and child placing agency workers and kinship caregivers will all utilize. That will go live on at the same time on July 1st. That information will be there. So hopefully that can help explain some of the WACs. And then the WACs, once they go live, will be available just like our foster care WACs are.
I will say that when you guys get in and you start working on these forms in WCAP, if you noticed like errors or it's not working the way that you want, we would love for you to reach out to the WCAP and just let them know. And I'm going to put their email address in the chat, which I hope you already have. But if you're working in a form, you're like, wait, there's a grammar error, or this doesn't actually work the way that we want it to, just like you do now, provide that feedback. Because we will review stuff and look at things for future enhancements if we need to. So that's really important. I also say that just because one coworker emails us doesn't mean that you can't email us as well. It kind of helps us say, how many times is this a problem? I think that when we first got WACAP, I would be like, oh, well, my supervisor emailed, so I don't need to. But then I came to WACAP and I realized, oh, we're like, wait, how big is this problem? So if you see it, then please go ahead and let us know. Does anybody have any questions? Does anybody else, like Deanna, Renata, do you have anything you want to say before we close out? Quiet. Okay. Reach out if you have any questions. And then thank you so much for coming. And again, next month will be our last one. Wait, I think we have one more question that just came in the chat. Let's see here. We get a lot of panicked families regarding the automated emails from WACAP. Is there a way to address these when families are done with forms, or should I send that feedback to the email? Oh, that's a good question. Does Emily or Renata want to take that? Do you want to give the back?
Yes, go ahead and send that in to the feedback, and we do provide our feedback back to Binti directly, and there have been a lot of changes that have been made. For example, the ad requirements and other changes. You know, they're a system that continues to update and make changes as they get feedback from their users. So give us the feedback. We will fix what we can on our end, and we will pass what we cannot fix on to Binti, asking for them to fix it.
I do think that the work group looked at some of the emails to try and soften some of the way that they were worded with this new project too, correct, Shannon? So that it's not so like, you left stuff undone. Hurry, quick, fix it. You know.
Yes, I do think we made some of the language changes to that, although I can't remember what they are off the top of my head.
We did. We made language changes to that and the stage language, but they're still going to get that email even if they've already completed all of the forms. So we hope to be a little nicer in our messaging to them, but they will still get it. So yeah, provide that feedback. Any other questions or thoughts? Any chances with the changes coming, WACAP will be available to our Spanish community anytime soon? Em or Renata, do you guys want to take that?
So it is our goal to have the portal available in Spanish. There have been so many changes that it was prohibitive. Our goal is that we will go live with this kinship track and that everything will be fantastic and we won't have tons of changes requested, and then we would get it translated into Spanish. That is our goal. And then on the foster care side, you know, we know changes are coming with negotiated rulemaking. So we'll be updating the track at that time and hope to get Spanish on the community foster care side after that. We have lots of goals. Those are our goals. So that's what I can say at this point. I don't know if Deanna has anything else to add.
I would echo that, and I would say we have not lost sight of it. It's just that we need a stable system in order to translate it. So we are waiting for that moment of stability where it will be a benefit to our families and our staff to implement that function.
There's a question, Deanna. What about the WACs in other languages? Are you able to take that one?
Sure. We are working on a systemic response to translating the WACs in other languages, and we will have them available to staff to access for families who need them. We cannot translate them until the WACs are live, so we will be working on that, and then it will also be something that we will send to families with identified preferred languages as those become available to make sure that those families are equipped with the new WAC in their preferred language.
This is a child placing agency question. Just want to clarify, any home studies that we're currently working on need to be submitted by June 2nd. That date sounds right to me, and that's to give the regional licensing, yes, sorry, kinship home studies only, and kinship renewals only. This is the kinship track. Yes, so that regional licensing has time to review, corrections can be made, and that we can get it approved by the end of the month.
I'm lost. Okay. So it's not a question. How, as a cancer notification specialist, or what more can I do to help, with this process, if that made sense? I know I don't go in the homes, I don't do all this, so I get them started. Is there, I get them, I get my clients all the way to SAW, and I get them to the first, to the applicant part, and then usually they'll just keep going. But is there any more I can help, or whatever I can help, let me know. How about that?
Thank you, Shannon. The KNU has just been such a great unit to work with our kinship families as they get placement and are overwhelmed by the system. And so if we have any feedback for the kinship notification unit, they are also looking to always improve. I appreciate that, Shannon.
And I guess I'm more so, I don't want to do too much at the same breath, I don't want to add to the workers, add to it. So yeah, for Shannon, so yeah, that's another part of me, Ms. Renata.
Well, I'm just going to be mindful of time, and we are over by a minute. And so for those of you that need to hop off and move on, you can go ahead and do that. If you would like to stay and ask a couple more questions, you're more than welcome to do that. Thank you so much for coming, and we will see you guys next month.